Okay, thank you very much, Prof. Fatima. I am Zarina. Okay, so today I am going to present a study on the title Quality of Life and Intensity of Pain Among Students with Low Back Pain During COVID-19 Pandemic. Okay, can everyone hear me? Yes, all right, very great. Okay. I am very sorry here. Yeah, I've been asked not to put on the whole slide for slideshow. Yeah, because it will disturb the Zoom presentation. Okay, so I have to remain in this platform for presentation. All right, before I move further, is anyone here having low back pain? Oh yeah, there are numbers of people down there that having low back pain. All right. However, today, yeah, my focus is more among the students. All right. Okay. As what we know that, yeah, we are still in the movement control order. Yeah, but we are shifting towards the endemic scenario. Yeah, and this study has been done during the pandemic COVID-19. Yeah, and why it is a need to find out about the low back pain among those that involved in the pandemic, especially the students. Okay. Yeah, it is because people have to stay at home during the movement control order. And there were restricted outdoor activities during that particular time, okay, which reducing the active participation among all the population. Yeah. And because of this restriction, it leads to low back pain. What is low back pain actually? Yeah, low back pain is defined as the pain at the lumbar region. Where is the lumbar region? Lumbar region is between the rib 12 to the sacral one of your vertebral level, right? And as what we know that low back pain is a common musculoskeletal disorders. Yeah, what is musculoskeletal? Musculoskeletal is basically the disorders or the condition that relate to the muscles and also to your skeleton, to your bones. Yeah, so as what we know, low back pain is always involved the scenario or the disorders in the vertebra or the bones. Yeah. Of your spines, and also about the muscles, So that's why it is common disorders of musculoskeletal, and it is have a high prevalence, globally, which affecting up to 84% or beyond 84% in some studies, in global adult population, and it can be classified as acute low back pain, which commonly affecting people less than 6 weeks of period. And subacute low back pain between 6 to 12 weeks, and also the chronic, which is more than 12 weeks of involvement. Why it is important to study about low back pain among the students? As what we know that for students there is high curriculum demand, which leads to exposure to higher stress levels, and also leads to sedentary lifestyle as time occupied for learning and rest. Most of the students have to sit for a prolonged period of time during the lecture. And this will increase the pain, even among those that healthy. And also with this scenario will increase the stress levels, which worsens the pain. And this will lead to reduction in QOL, or quality of life, among the students. Yeah, and this basically provokes the increased prevalence among the students, prevalence of low back pain among the students. Okay. What's impact of low back pain and pain intensity on physical activity and also the quality of life? Yeah, as what we know, low back pain, together with the pain, it will affect the independence in the activity daily living, okay, which worsen the functional disabilities such as the dressing, sitting, standing, or walking. Okay, these dressing, sitting, these functions we always call it as physical activity, and physical activity, which is not having structured intensity or structured timing for the activities. Okay, the secondly, pain may reduce the physical activity, whereby students need to rest and sleep during the free time and avoid the exercise because of they have prolonged learning situation. And thirdly, exercise and physical activity positively reducing the pain, and also increasing the function. That's what's supposed to happen. Okay. However, during the MCO period, this physical activity has been restricted. All right. What about the quality of life then? Okay. Low back pain and pain will increase the intensity of pain. That is understood, isn't it? And therefore, it will reduce the quality of life. Especially the mental health component of quality of life. And quality of life is reduced among women more than the men. This from the previous studies. And by reducing the QOL or quality of life, it always related to pain intensity. Okay, and up to now, only a few studies determine the association between low back pain, pain intensity, and quality of life among the university students. Therefore, more studies should be conducted involving these two variables, which is a physical activity and also the quality of life, to determine the correlation among students with low back pain. Okay. The objective of the study was to compare quality of life among students with and without low back pain, and also to determine the association between quality of life and pain intensity among students with low back pain and the Faculty of Health Sciences UiTM Puncak Alam during the pandemic of COVID-19. All right. This study was designed as a cross-sectional survey. And the sample size was calculated using a rows of software, whereby the sample size turned out to be 420 participants. And it involved the students from the Faculty of Health Sciences. We used SF 12 version 1 for QOL, and also numerical rating scale. In a short form, it is NRS for pain intensity. Okay, we included the undergraduate students in the Faculty of Health Sciences, with the age between 19 to 24 years old, and we exclude those from postgraduate chronic illnesses and also other health problems. We received the ethics approval from UiTM, and the data were analyzed for demographic independency tests are also chi-square. Okay. All right. Here are the demographic characteristics of study population results. We found that the BMI was quite high. In moderate. Okay. Among 190 participants, which are the majority of the participants having BMI from 18.5 to 24.9. Okay, and it involves majority female, with high prevalence or high numbers of low back pain. All right. And here are the results of comparison of QOL between low back pain and non-low back pain. We found there was significant difference between the groups, yeah, and there was no association between QOL and pain intensity that been found here. Okay, so for the discussion, yeah, we found high prevalence of students with low back pain, which is more than 60%, and this could be due to prolonged duration during attending the online classes, yeah, which led to increased pressure on the spine and increased low back pain, yeah, and also stress during lectures and increased loads for assignments caused the increased pain intensity as well. Okay, for objective one, we found there was reduction in quality of life in people with low back pain than the non-low back pain. And this also because of high demands of the curriculum during the studies, yeah. And these students, yeah, have to sit or have to present with a sedentary lifestyles, yeah, poor posture and exposure to stress, restrictions or limitations on sporting activities, yeah. And for the objective two, yeah, the pain intensity was not significant with quality of life among students with back pain. Okay, this could be due to minimal pain intensity present with those that having low back pain, and as what we know that young age group may have a better coping strategies for pain. Yeah, and as for the conclusion, this study suggests a high prevalence of low back pain among students in the Faculty of Health Sciences during the pandemic COVID-19, and the presence of low back pain with mild pain intensity among the university students might not influence their pure quality of life. Okay, thus, therefore, no association between quality of life and pain intensity was found. Okay, further research need to explore a more comprehensive understanding of the relationship between the intensity of pain and quality of life among the students. And besides, preventive measures should be developed and carried out to minimize low back pain among the population. For instance, the educational program to minimize the incidence of low back pain. With that, thank you very much. And I will also thank the Universiti Teknologi MARA for the MARA grant that supports the financial for this conference. Yep, thank you very much.
Thank you very much, Mrs. Hari, for this very interesting presentation, and also for the choice of the topic that is quite an interest for populations, young and old today. Okay.
Thank you very much.
I was wondering if there was a question in the attendance. Does anybody have a question?
I have.
Yes. Okay, Prof.
The question from the audience tonight. The audience.
All right.
So, I myself actually have this problem of my pain. Any particular advice or any particular situation where you can get rid of rather than have some kind of relief?
All right.
All right. Maybe my question will not be necessarily, very much your
population,
but this is just a general question. Thank you.
All right. Okay. Thank you very much, Prof, for the question. Okay, as what we know that low back pain is happen to everyone, okay? And it depends on the scenario and it depends on the age as well, okay? So what can be done to prevent the low back pain, okay? It's very hard to say actually, okay? But to my understanding and from the previous research, what we found were to provide sufficient knowledge, to everyone, especially to the people in the community, okay, on the understanding of the low back pain itself, yeah, on the anatomy of low back pain itself, okay, what are the structures that should be or could be involved, yeah, among those that are presenting with low back pain. They must understand that, why it happened, yeah, what happened to the structure, and so on and so forth, all right? And it could be also, yeah, we have to let the people to understand, yeah, about the causes, not only about the anatomy, yeah, the causes. What are the common causes that may contribute to low back pain? Yeah, for instance, yeah, the age. Yeah, Dr. Chua has presented about the age. Among the adult, and Dr. Aki-san, yeah, was talking about the elderly. Yeah, my previous studies, yeah, was among the elderly population. Yeah, and we found there are high prevalence also, yeah, among the elderly people. Yeah, high prevalence of low back pain among the elderly people as well. So we need to provide them with specific education, yeah, again, on the anatomy or structure, okay, on the causes, yeah, on the the choices, yeah, of preventive measures that can be done, yeah, so that they have a multiple choice, yeah, they can relate with their condition, yeah, and how to take care to get rid or to avoid the pain. Yeah? And as what we know that low back pain is number one cause of disability, yeah, in the world. Yeah, and it's really hard to cure. Yeah, most of the cases, yeah, it's recurrent. Yeah, they goes out for a short while and then come back. Yeah, so there are multiple factors that are affecting this, and as what we know that these can be adjusted based on your activity. Okay. All right. Am I answering your question, Prof? Okay. Thank you so much.
I have a question for you.
Yeah, sure.
And I'd like these to go straight to the point.
All right.
I was wondering if your sample, you studied back pain with students, university students, students of health.
Yes.
School from 19 to 24.
Yes.
I was wondering if you compared your sample to same age students.
All right.
Taking into consideration their lifestyle.
All right.
Whether it is within COVID or outside of COVID. For your same sample, have you tried to understand whether it is COVID or whether it is sedentary life? Because we know that youngsters today don't practice sports as much as they used to. They don't have outdoor activities. They are stuck to their phones, etc. So it would be interesting to see, to try and check if the validity of your hypothesis against these people's lifestyle before COVID and during COVID. I don't know if you did this, and also to compare it to another sample, same age, same situation. Have you done this?
Okay, I didn't do the before COVID, yeah, among the similar age group people. However, there were previous studies that showed, yeah, inconclusive evidence. There are some studies that showed high prevalence, yeah, and high prevalence of low back pain, and also there are some studies that shows quite lesser prevalence, yeah. But yeah, there are studies, yeah, which had been conducted among the medical students, yeah, had showed high prevalence of low back pain, which could be due to some other reasons of curriculum. And also there were studies that had been conducted during the similar age, among the physiotherapy undergraduates. They also had found high prevalence of low back pain among the students. So that's before the COVID-19 pandemic. However, during my study, during the period of COVID-19 pandemic, it has been found similar findings, high prevalence of the back pain among the students, in health sciences.
What does it tell us?
It could be because from some other studies which not involve the medical faculties or medical programs, they do not really show high prevalence of low back pain. So what I can say here is, for the health particular programs students, the studies have shown high prevalence. It could be due to their activities. Some studies reported that they were due to, say, for the nurses, they had to do the lifting techniques. And similarly to physiotherapy students, they had to do some lifting techniques, during their clinical practice that has led to the increasing prevalence of low back pain.
Maybe there
may be some other factors as well.
Studies that they are carrying on are also more stressful than the other stuff that might be other studies.
It could be that.
Okay.
Thank you. Thank you very much.
Okay, are you the...
I am the second presenter as well. Yes.
How come? Okay, so this time,
continue.
Take the time that you took for the first presentation from the second presentation. Fair enough?
All right. Okay, shall I start? Yes, all right, okay. Thank you very much, Prof. Fatima. Okay. All right, my second presentation is about the effectiveness of manual therapy on pain, disability, and quality of life for elderly with low back pain. Okay, this time is about the elderly population. All right. Okay, as what we know that low back pain is #1 cause of disability and socioeconomic loss globally. There is high fear avoidance belief from the physical activity, from the work, abnormal anxiety, and also from the depression. Okay, and the prevalence in Malaysia, the prevalence of low back pain, is about 40 to 73%, okay, which involves the community dwelling elderly, about 26%, and from the institutionalized elderly, about 63%, okay, where here we can see that institutionalized elderly has shown higher prevalence as compared to the community dwelling elderly. Okay, there are multiple reasons for this. Okay, what happens if this low back pain is not being treated well among the elderly? Okay, this will lead to sleeping disorders among those population. Okay, it may also reduce the functional ability It may also contribute to falls among the elderly, malnutrition, emotional distress, impaired cognition, okay, and also avoidance of social and recreational activities. Okay, this is what you can see that happen surrounding us. Okay. What are the effects of manual therapy on low back pain? Before we move on, you should know what is manual therapy. Okay, manual therapy, it comes in various techniques. For instance, massage, yeah, you do the spinal mobilization, you do manipulation, that comes under the manual therapy. What is the definition of manual therapy? Manual therapy is a passive and skilled movement which is performed by the clinician. Or here, yeah, we always refer to physiotherapist or the therapist, yeah, on various anatomical structures or the systems, okay? Like previously, Dr. Chua had mentioned about myofascial release. Myofascial release is one of the techniques of massage, yeah, which is also a part of manual therapy, that focusing more on the muscle and fascia, okay? But here, manual therapy is broader, okay? And it is more specific to the manipulation, mobilization, and different types of massage therapy. Okay, what we can say here is that, okay, manual therapy helps to reduce the pain intensity, okay? Or pain severity, other name or other term for the severity. Okay, how does it work? Okay, it causes changes in the sensory, yeah, sensory nerves, yeah, in our skins and also the muscles that leads to pain reduction. Okay. This manual therapy also helps to reduce muscle tension, restore the mobility of the joints, and also increase the physical function. Okay, how does it work? Okay, this can happen, yeah, by increasing the blood circulation surrounding the region that had been conducted the manual therapy. Yeah, it also helps to relax the muscles. Therefore, you can move better. Yeah, and also it break up the scar tissues and relieve pain and the soft tissue. What are the soft tissues? Soft tissues, it could be the like the muscles, it could be the fascia, it could be the ligaments, it could be any kind of soft tissues. Yeah. Therefore, yeah, by increasing or improving all those things, yeah, it helps to activate a better muscle work. Yeah. Promoting increased lumbar motion to gain better physical function. Okay, all right. In terms of psychological effects, yeah, how does it work? Okay, it helps to improve the fear avoidance belief. Okay, because in most patients, they always think of, yeah, activity, yeah, will harm their function. Yeah. Pain can cause harm. So with that perception, it will always, yeah, limit them from doing the activity. Yep. For the quality of life, how does it work? It can improve overall quality of life in physical and also in mental health. Okay. However, studies on manual therapy showed a positive effect on pain and function, but most did not include the elderly population. You can find various studies, okay, on manual therapy, but they are among the younger population. Okay, and this causes limited evidence for firm clinical recommendation for manual therapy among the elderly with back pain. All right, the objective for this study to determine the effectiveness of manual therapy in the elderly with low back pain on pain, physical function, disability, quality of life, and all psychological aspects. Okay, the methods is the systematic review. We followed the PICO inclusion criteria, okay? And the search strategy, we used all the available data, electronic databases in UITM library, Okay, and we use Appraisal tool by McMaster Clinical Review Form for quantitative studies. Okay. We exclude those that combine manual therapy with other treatments, including patients with radiculopathy. Radiculopathy means that any radiating pain that involves the nerve. Okay, like patients that have pain that radiated from the back to the foot, okay, or to the thigh. Okay. All right, and those that have the other comorbidities, acute low back pain, history of a surgical intervention. Okay, we for analysis, we extract the data and then appraise and report using the Prisma. Okay, this is a Prisma diagram flow of search strategies. Yeah, we search many studies from there. Yeah, from Science Direct, EBSCO Medline, PubMed, Google Scholar, and so on. Okay, and then from this search, we exclude or remove the duplicate studies, which about 2,100, and then finally, we included 3 reviews which follow the PICO criteria. Okay, the results from these 3 studies, we found that study by Lemon, 2013, there was reduced in pain and disability in both manual therapy and non-manual therapy across periods of their study. And this study also showed fear avoidance belief improvement, fear avoidance belief in work. We have 2 components of fear avoidance belief, physical and work. But this study have included those in work. Doherty found also reduction in pain and disability. And Sharps found reduced pain and disability as well. Okay, so these 3 studies have shown good improvement in reduction of pain and disability. All right. For the physical function, Doherty and Sharps have found the positive findings, the significant value. For the disability, all those 3 studies, for quality of life, only Sharps have shown good effects on that. And for psychological aspects, Lemon. Okay? All right. For the discussion here, okay, this study have showed improvement in pain intensity among elderly with low back pain. Sorry, the arrow is supposed to be downwards. Here it shows improvement. The arrow upwards means improvement. Okay, pain reduction could be due to changes in biomechanical and neurophysiological factors that happened in the sensory systems. And changes in nociceptors resulted in reduction of pain intensity and discomfort experiencing pain. For improvement in physical function of the elderly with low back pain, this could be due to pressures applied to the specific painful region in the body block, the pain stimuli, and reducing the muscle spasms, which allow more painless and free motions. And the technique of mobilization and manipulation will break the adhesions in the stiff joint. Therefore, it helps to improve the range of motion in the spine. Okay. The improvement of disability or reduction in disability, this could be due to increased physical function. Okay, more functional activities can be performed easily and more independently, which helps to reduce the disability in the elderly with low back pain. Okay, and the reduction of pain and also increase the confidence, will allow more socialization and improve activities among this group of people. Okay, increase the quality of life by reducing the pain and disability definitely will lead to increase the quality of life among the elderly. Yeah, and overall improve psychological aspects. Okay, when there is increase in function among elderly with low back pain, this might cause by reduction of fear, yeah, which allow them to move better. Okay, so as for the conclusion, this study shows a significant improvement in pain intensity, physical, and also the physical function following manual therapy among the elderly with low back pain. Okay, and yet, the information is scarce or is limited, due to lack of study involving the elderly. You may find many studies among the adult population. However, it is very, very limited, among the elderly group. And therefore, further investigation of the effects of manual therapy in the elderly with low back pain is greatly needed, to gain more convincing evidence for clinical practice as the number of elderly population is mounting in the world. Okay? With that, thank you very much. And I would like to acknowledge the UITM, for the grant, to support for this conference. Thank you very much.
Questions from the attendants? Any questions? No? No questions. Okay, great. So, do you know of any current studies that actually work on the relief of back pain and therefore disability with the elderly in hospitals, for example, using manual therapy?
Okay, all right. Thank you, Prof. Okay, there are one systematic reviews that focusing on the physiotherapy management for low back pain among the elderly. Okay, this study has concluded that quite similar to this presentation, but they involve a variety of physiotherapy, not specifically to manual therapy. Okay, it shows a very limited evidence on the study for low back pain among the elderly. So therefore, what had been practiced outside there, is general physiotherapy. And it also recommended by the guidelines, global guidelines for low back pain management. There's no specific guideline yet, for the physiotherapy management for the elderly. Currently, we used similar approach with the adults, other adults, which is not meant for the elderly. So we use multiple interventions, combined interventions, manual therapy, plus the exercise program, plus the pain modality program to improve the condition for pain and also for disability. Am I answering your question, Prof?
Yes, thank you.
Yeah, thank you very much.
Thank you.
Is there any question from the floor? No question. All right. Thank you very much for listening.
Next presenter, please. Mrs. Hasmin Gafar.
Okay, good afternoon. Can you guys hear me? To everybody? All right, so I'm Aslinda Fuhad. I'm a representative from the FSK Physiotherapy Department. So I'm going to present about this is my topic, does physiotherapy improve physical functions, kinesiophobia and quality of life in individuals with back, knee and ankle problem. But before we start, let me define what is kinesiophobia because it's quite a new definition. Kinesiophobia is kine means it's a movement, and then the phobia meaning is you scared. So when we combine the kinesiophobia, meaning that you are feared to move due to the psychological, which I will explain further. Okay, so this is my background. So why does this very important to understand the physiotherapy management in improving the physical functions, kinesiophobia and quality of life? Why does it important? Because it will increase when the patient's having pain, reduce physical functions and kinesiophobia, it will increase the financial burden and absentee of work. Therefore, and also it will increase physical, biochemical, kinesiophobia and quality of life are associated with poor prognosis of musculoskeletal pain. I believe that Dr. Zarina already explained what is musculoskeletal pain, right? So I just escape it. So why? Physiotherapy management has shown that considerable increase in patients' functional capacities and reduce their kinesiophobia. So it shows that the males are actually suffer from kinesiophobia more than a female, which the prevalence is 50% male develop kinesiophobia than the female, which shows 70%. 70%, yeah. For the kinesiophobia, usually it happens due to the lack of physical activity in patients, which therefore it reduces the quality of life. 63% of physiotherapy management follows the guidelines of systemic review on the recommended care for musculoskeletal disease. So my studies, the objective is to investigate the effects of physiotherapy management of physical functions, kinesiophobia, and overall quality of life in patients who suffer from conditions that affect the lower back, knee, and ankles. So this is my methods. The design is literature review. So I use PICO to measure. So for the populations, the subjects with low back pain and lower limb musculoskeletal conditions. For the interventions is the conditions of the musculoskeletals that require patient PT management, which is the physiotherapy. Comparison, I'm comparative study of the effects of quality of life and kinesiophobia on the treatments of physiotherapy. For the outcome measures, all outcomes about musculoskeletal disorders, quality of life, and kinesiophobia. For the search strategy, I'm using the PubMed and Science Direct. For keywords, I'm using the P-review and lower back pain, hip pain, knee pain, ankle pain, kinesiophobia, physiotherapy, and quality of life for the search term. For the inclusions criteria, I'm using the full text language articles. The outcome measure was WoS, VAS, Visual Analog Skill, from McGill Pain Questionnaire, the Nottingham Health Profile for the quality of life, Tampa Skill for the kinesiophobia, knee outcome surveys activities of daily living subskill and global rating skill, and FAM. I'm using the English. For the exclusions criteria, unrelated title keywords to research terms, teams, ambiguous papers, unfinished studies, study protocols, abstracts, and reviews, and non-English papers. For the data extractions, the study design, sample size, and inclusions and exclusions criteria, the interventions, the results and the conclusions, summary, design, interventions, outcome measures, and the time points. For the data analysis, all available schools papers, the publications were ranked according to the guideline hierarchy level of evidence established by the National Health and Medical Research Council, data extractions, appraisal, and reporting using the PRISMA. So this is my Prisma flow diagram of each for the search strategies. As when I search, the PubMed shows that 47 papers, Science Direct shows that 261. But after I review everything, I only have 4 papers that included in my literature review. So this is one of the results. There is 2 lower back pain for the articles, 1 knee pain and 1 ankle pain. 2 lower back pain shows that these 2 papers conclude that lower back pain had a more severe form of kinesiophobia. Kinesiophobia harms an individual's quality of life. And PT physiotherapy management effectively relieve the pain, kinesiophobia, and functional impairment in patients with mechanical lower back pain. For knee pain, strengthening the quadriceps help decrease kinesiophobia and increase physical functions in returning to sports for ACL repair rehabilitations. For the ankle pain, they conclude that functional ankle instability exhibited higher anxiety of mobility, decreased physical functions, and a decrease in their quality of life. And therefore, they evaluate patients' perceptions of their functions and their psychological elements. Okay. Discussion lumbar. I put it into 3 variables for each. So for the PT management that you discussed for the lumbar, I think Dr. Zarina already mentions about the general physio management for the lumbar. But here it shows that stretching, hip pecs, back flexions, and extension exercises, it will reduce the lower back pain. Therefore, it increased kinesiophobia and it reduced kinesiophobia and reduce the quality of life. And kinesiophobia affects quality of life and requires lower back pain management from the physio. For the knee, this is the management which use physiotherapy management, which use the modalities: patella tapping, quadriceps strengthening, VMO, vastus medialis oblique, which is one of the quadriceps muscles, strengthening and activations, hip strengthening, flexibility, dry needling, and the recent one is the blood flow restrictions exercises, and then the preoperative neuromuscular training, post-operative rehabilitations. This study shows that the PT management increased physical functions and quality of life. But however, for the knee, there was no study done on the kinesiophobia. Okay, why kinesiophobia is very important? Because kinesiophobia reduced during SCL reconstructions, rehabilitations, and are associated with functions when patients return to sports. Strengthening the quadriceps helps reduce kinesiophobia and improve physical functions in returning to sports for ACL repair rehabilitation. For the ankle conditions, there were no specific ankle management was discussed in the Wallenkar et al. Study. However, Wallenkar found that people with functional ankle instability had higher mobility anxiety, reduced physical functions, and reduced quality of life. Incorporating the physical functions, quality of life, and kinesiophobia into an evaluations of these patients will provide a holistic and multimodal approach to understanding, planning, and therapy. Okay, for this study, we recommend, due to the insufficient research and data, the absence of data on patients' use and dosage of analgesic, anti-inflammatory, and antidepressant drugs, which may have altered the quality and intensity of the pain. No research on the link between the kinesiophobia and pain and disability. The influence of kinesiophobia on the cost of lower limb physiotherapy rehabilitations was not completely recognized. Beneficial to do an in-depth research. Future clinical practice and study recommendations should combine physical functions assessment and treatment with kinesiophobia assessment and quality of life assessment. experimental research utilizing BPS, which is biopsychosocial techniques that methodically address and diminish kinesiophobia, and studying the influence of kinesiophobia on physiotherapy rehabilitation management. So my conclusions, overall, these 4 studies concluded that physiotherapy management improved physical functions, kinesiophobia, and quality of life on lower back pain, knee pain, and ankle pain. This study also suggests inconclusive evidence on knee pain and ankle pain due to limited study on physical functions, kinesiophobia, and quality of life. Therefore, further study needs to be done to explore on these methods. For the end of these presentations, I'm going to acknowledge the Faculty of Health Science, UiTM, and the grants for the financial support. Thank you.
Thank you. Thank you very much. Indeed, very interesting. Again, very interesting topic. And thank you, especially for sticking to the time and being here and concise.
All right.
Any questions from the floor? No questions from the floor? So, it's not a question. I just wanted to maybe understand better. What do you mean by elderly?
Elderly?
Yes.
Okay, I would define that elderly are more older person. I would say that 60, the age 60 and above are considered elderly.
Starting from 60.
Yes.
Okay, so this is your target population actually.
For my, this is my literature review, but for my future, I would prefer more active person.
But for your lit review,
yeah.
In your lit review, it was people 60 and above.
No, this is a general populations.
Okay.
General populations.
All right, it's not 60 and above.
No, okay. It's a general populations, but I can say that more on the lower back pain is more on the elderly, but the studies involving the knee and ankle is more on the younger populations.
I would be interested. Anyway, you said that further study needs to be to explore certain number of things.
Yep.
It would be interesting to go further into exploring the cycle, as you said, the physical, psycho, etc., lifestyle, social, also, etc.
Yeah.
Yeah.
I'm a PhD student right now, so my future studies are actually involving the kinesiophobia biomechanic on the knee in the healthy person. So it's involving everything. So this is one of the ice-breaking thing for me before I go through my future studies. Yeah.
Have you considered the opposite?
The elderly?
No. Actually, kinesiophilia and not kinesiophobia with the elderly.
I can take it into a consideration. Who knows?
Because you know, when we get older, we become more and more stubborn. Yeah, I agree. And sometimes with the elderly who might be suffering from ankle pain or back pain or whatever, and who should not have a certain number of movements that who want to do these movements. It could be interesting to compare this population with kinesiophobia and the same age population with the opposite. You know, I don't know, but it would be interesting to
think about it, right?
To see these things.
Yeah, I will take it into a consideration.
Very interesting topic and thinking, triggering.
Thank you.
Thank you very much.
All right.
Thank you.
One just a comment, brother.
Yeah.
Is that something to do with laziness, rather?
Kinesiophobia?
Yeah.
What do you mean by laziness, Prof?
I mean, laziness to move about.
Not really. Okay, let me put an example. Sometimes I feel lazy to do exercise, but I'm not scared to move. But when you have kinesiophobia, for example, I'm very active in doing exercises. I lift weights, I do a lot of things. But when I injured my shoulder, so I already recovered, but then I like, should I do this movement because I'm scared I will be injured? That's kinesiophobia. So it's totally different.
So basically, kinesiophobia is like losing motivation.
No, losing motivations are totally different. Losing motivations, I would say that I don't want to do. I just like, I don't care. It's like more on the psychiatric or psychological problem. But kinesiophobia is totally different. I want to move, but I'm scared. I'm too scared to move because I'm scared that I will re-injure myself.
Meaning it is very much due to bad experience.
Yeah, I would say that.
Yeah, once you have already stumbled upon, and then you already realize
Is it
it was to
systematic?
be repeated.
Yes.
It's
It's already proven in lower back.
Is it systematic?
Yes, it's systematically reviewed by lower back pain. But there is no study found on the knee.
What I mean is past experience, is the systematicity of past experience proven?
Yes, it was proven. Yes.
Oh.
But mainly on the lower back problem.
Huh?
Generally, globally, it's more on the lower back.
Oh.
Yeah, so it's proven that when you have lower back pain, in elderly especially, you will develop kinesiophobia compared to other region.
All right.
Yes, very interesting.
Thank you.
Thank you. Thank you very much.
That's a lot.
Yes.
1.5 years, maybe my paper will out.
Oh
yeah, sorry.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. And a very good afternoon to the Madam Chairperson, Professor Dr. Fatima, Prof. Masran, Prof. Gita, and members of the hall. I'm Shafira Ibrahim from Faculty of Health Sciences, Universiti Teknologi MARA. And together with me is my co-author, Madam Nina Gartika. Madam Nina, are you there from Bandung, Indonesia?
Yes, Prof.
All right.
Good afternoon.
Okay, thank you so much for being together with us. And today, my team and I would like to share our project titled Prevalence and Factor Associated with the Low Back Pains among type 2 diabetes community. So before I begin, because we have new members just coming in, can I see your hands again? How many of you have experienced low back pain recently, which is this year in 2022? Can I see a hand again? All right. Thank you. Every day. Ladies and gentlemen, low back pain is a type of disorder that increasing numbers over the time. This is a common scenario that we experience. Okay, as we are from the SMASH Pre-Diabetes Research Group, our focus is on a diabetic community. I would like to draw your attention on the statistic in 2021, which is having clustered by several regions via the International Diabetic Federation, and stated that in the purple bubble, which is from the Western Pacific region, they state that 206 million of people living with a diabetes. The interesting part is that Malaysia is clustered under this category and this region. Okay, so back to the Western Pacific region, which is 206 million of people living with diabetes, including Malaysia. So if you look at on the statistic in Malaysia, 1 out of 5 adult Malaysian are diabetes. This is what have been reported. So when we talk about diabetic patient, we are actually often been getting the feedbacks, and also study also reported that they often have a musculoskeletal problems. However, this has been frequently neglected because of other complications, for example, the nephropathy or retinopathy. Thus, our group would like to investigate the prevalence and also the associated factors with the severity of the pain intensity and also the disability level because of the low back pain among a diabetic patient, specifically in the Klang Valley, Malaysia. All right, so before we begin the study, we try to find the connection. What is the mechanism link between the low back pain and also diabetes? So from the literature search, we found that when the blood glucose levels increase, well, we can detect it via the HbA1c, they have an increased abnormality in the collagen deposition at the connective tissue. And thus, this will lead to the changes of the structural matrix tissue and the mechanical properties. That is one mechanism. At the same time, ladies and gentlemen, when we have a blood sugar levels increase, it will lead to the increase of the age. We don't want age in the system, in the human body, because age is advanced glycation end products. When we have this a lot in the system, we have a lot of oxidative stress, and we have lead to the pro-inflammation that can lead to increase more spinal degeneration. Okay, so at the same time, I would like to draw your attention also here. We find from the literature, they have few other studies saying that the prevalence of the low back pain in the country is more on the diabetic community compared to the non-diabetic. Let us now move to how we conducted the study. This is a cross-sectional study, and after we got the article approval, we are completed the recruitment via the inclusion and also the exclusion criteria, where we went to the hospitals and also the NGOs center in Klang Valley, Malaysia. So once they agree to join the groups, we done on the socio-demographic data, and the first instrument to check on the prevalence is via the standardized Nordic questionnaire, and the second instrument is checking on the pain intensity, which is the Wong-Becker face pain scales, and the final one is on a disability questionnaire to check on the severity, which is the revised OWESRI LBB disability questionnaire. Okay, now let's I would like to bring all of you on the result that we got, which is the first one is on the socio-demographic characteristic, where from here we found out that most of the participants are Malays, and also 62% of them are working individual. That is the first one. And then the prevalence that we got from this study is that 55.3% of the participants suffered from the low back pain in the past 12 months. And I will try to ask again the question whether they have suffered in the last 7 days. And from here, 64% saying and claim that they are experienced and suffered from the low back pain. Okay, now, table 3, ladies and gentlemen, is the association between the socio-demographic data and also the condition, which is we found out that fasting blood glucose, number 1. Number 2 is employment status, and also the education levels are significantly associated with the occurrence of the low back pain in our community. Okay, and the final slide on the results saying and on the pain intensity, which is a table 4, described under most of the diabetic respondent claim their pain is at the moderate level, which is between 4 and 6, and the final one, which is table 5, showing that 47.4% of them had also a moderate disability due to the low back pain. Now, what can we say from this study? So based on the 12-month prevalence of the low back pain among the type 2 diabetes participant, we can say that the prevalence is quite high, which is more than half, 55.3%. And this is in line with the other country, for example, in Iran and also in Nigeria. However, ladies and gentlemen, their pain intensity and disability is at the moderate level. That is a good thing, okay? And we also found there's a significance between the fasting blood glucose levels and also the low back pain. And this is actually answering the theory mechanism saying that when the glucose levels is high concentration, it will be released a lot in the system, oxidative stress happen, inflammation happen, and this will do the pro-degradative effect to the individuals. And finally, on the second and also the third factors also, which is significantly associated with the higher risk of experiencing low back pain, which are the employment status and also the education levels. So these might be reflect to the way of working, their posture, their sitting during their daytime. So as a conclusion, the prevalence of the low back pain was high among people living with type 2 diabetes in Klang Valley. That's number one. Thus, we would like to suggest the physiotherapists need to be aware of this issue and give adequate attention to this type of problems. So appropriate prevention and also management strategy should be implemented. With this, I thank you.
Any questions from the floor? No questions from the floor. No questions from the floor? Okay. I don't have I'd like this question information. You said that your field of study was Klang Valley.
In the Klang Valley, yes.
Okay. Have you probed the prevalence of diabetes in Klang Valley before?
Yes, because we know among all the states, Kuala Lumpur and Selangor is the highest numbers of having these type 2 diabetes. And that's why we are focusing on this area.
Why you focus on
Yes.
this area. Yes. I don't know if comparing the comparison actually between Klang Valley, Kuala Lumpur also.
Yeah, Kuala Lumpur and Selangor. There's a part which includes parts in the Selangor, which is the Gombak, Klang, Petaling, and Hulu Langat. It's a big state. It's a big district in. Plus, Kuala Lumpur is what we call it as a Klang Valley.
Yeah. Have you tried to triangulate the results?
Mm-hmm.
I see that you consider education, consider the employment, consider the certain number of factors. But my question is how relevant education, for example, could be.
Because
employment, I understand.
Yes.
But education, how relevant is education?
Yeah, we try to link that. So we believe that when education, they have higher degree levels, they might be working in the office. For example, that could be because there's two things. One, either you do a heavy lift up, that the physical activity is more that contribute to that. Whether you are stand still too long of sitting also contribute to the low back pain. So from the discussion we created and we discussed previously based on the study, when you have a higher levels, you might be in the station yourself in front of the computer. So that could be contributing to that because
you might also be somebody with a better quality of life and better ways of managing the diabetes and managing all these things.
Yeah, okay.
So I know if education, I would say that education would help theoretically, have a better monitoring of your diabetes, of your health state, etc., than the other way around.
Okay. So we perceive the other way around. Yeah, that could be an input. Thank you so much, Rob.
Yeah.
All right.
I think also the technique in which you can actually either do a cross step or so that you will get a much more reliable kind of inference.
Exactly.
Yeah, it's very much what you mentioned as well. It's very much a guessing kind of work.
Yeah.
I say that that might be you shouldn't do that. You should have tested by way of doing cross tabulation. The profile of the respondents, these are the kind of things that you can rigorously.
Exactly, Prof. Yeah, that is a further that what we are going to do. But at this time of point, we don't investigate on that.
I'm just curious about, sorry, excuse me, to interrupt that. I'm curious about the prevalences amongst men and women, for example. Have you addressed this?
No.
No?
No, we don't look on the gender.
That's
That's another important thing.
Yes.
An important criteria. Because it's related again to, to lots of things, diets. When you think of diets, you think of hormones.
Yes, exactly.
And then, what do hormones do when you choose diabetes and then to back pain, etc., etc.
Exactly.
But then the only thing, because the data must be of certain kind of balance, otherwise it will be skewed towards whichever. But I want to ask a question, Sarah. When you mentioned about the different kind of levels, when they actually responded to you, there is moderate level,
High level, lower level.
How I mean, what is the measure that you consider one is moderate and one is severe, or one is light?
Well, because the instrument have been tested in 1990s, it quite established a questionnaire.
So, okay, but then how sure that the respondent actually responded to the question that
because in the Wombecker scale, they use a face scaling, which is they're not just answering via the question, reading and answer it, but they have a face showing that what is your feeling at that time. That's how the instrument helped the participants to actually address what their current feeling at that point of view.
So meaning that they are not just to ask
no. They choose beside them the question. They also choose based on the picture that reflect the feeling at that time.
All right. Thank you.
And what is the proportion of highly educated people in your sample? Have you again heard that?
Highly educated?
Yes.
Education levels, high university college is about 72%.
72%?
Yes.
Bias is from the start. I mean, from my point of view, maybe you have your reasons to go for that particular.
No, we don't have any particular reason why we choose, because from the samples that we got from the centers and also the NGOs, that's what the numbers that we got. So that's how we try to relate the factors and also the prevalence.
And is 161 sufficiently?
No, it is not sufficient because it is being conducted via the COVID periods. Yeah. So it's supposed to get about 3 to 8. However, we got 229. However, we have to exclude 68 because they are not under the Clan Valley citizens. And that's why we got the 161. So these data are 328.
Out of the population of how much? How many?
I forgot to put it here. Okay.
Okay. All right, thank you.
Thank you so much, Prof. Fatma.
Okay, the next speaker, please. Mrs. ABRA. Is that it? Or am I running? Oh, no. Oh, it's Dr. Zanzaniza, yeah.
So I'll continue my presentation. My title of my presentation this afternoon is Measuring Resilience in Healthcare Research During COVID-19, a scoping review of questionnaire. So now I move away from low back pain, but still this study is related to the healthcare research. So my team member consists of 4 members, Ms. Norfida, Mr. Norman, and Ms. Sumiati Sinaga, and myself, Zamzaliza. We are from Center for Nursing Studies, Faculty of Health Sciences, UITM, Puncak Alam campus. So for the background, as you know that we have experienced COVID-19 in 2020, and during that times, there's so many cases of mental illness, mental impairments, and mental disturbances reported by patient as well as by the healthcare providers. So from these problems, we would like to measure about resilience, whether or not resilience impacted on patients and healthcare providers' level of mental illness. So the word resilience actually originated from the Latin verbs resilia or to leap back. So, but in healthcare research, resilience can be defined as individual capacity to sustain or restore generally stable psychological and physical functioning in the face of difficult situation and hardship. For example, during COVID-19. So during the COVID-19, the work environment of healthcare personnel, including nurses, doctors, therapists, is stressful and demanding. And then similarly, once diagnosed with illness, patients and caregivers are often experience a high level of stress and impact their psychological well-being, especially during COVID-19, where there's a limitations of the movement and so on that impact their psychological well-being. And then resilience predicted various psychological distress such as anxiety, depression, and those with high resilience reported lower level of psychological distress. And then resilience also associated with positive mental health such as life satisfaction and personal accomplishment. And then to measure resilience, because of resilience can be confused with other concepts such as hardiness and so on. So the previous authors have developed numerous questionnaires to measure this concept. However, since resilience is a multifaceted and multifactorial, using a valid tool is very important so that we can really measure this concept. Thus, this review aims to determine the questionnaire developed and used and during COVID-19 and the domain of that questionnaire. So this review was guided by two research questions. What are the questionnaires used to measure resilience in healthcare research during COVID-19? And then what are the domains of resilience included in the reviewed questionnaire? So for the methods, study design, we use a framework for developing scoping review by Akshay and O'Malley, 2005. And then this framework outlined the 5-stage process of scoping review. From the first one, we need to identify the relevant research question, like I did mention before, and then identify relevant studies, study selection, chart the data, collect, summarize, and report the result. And then for the search strategies, we conducted search for the articles from two databases, Medline and CINAR. And then the keyword that we use to get the articles are resilient and healthcare and resilient and COVID-19, patients or client and resilient and patient or client and COVID-19. So, and then we conducted the screening and then to make sure that all the articles fulfill the inclusion and exclusion criteria. The inclusion criteria were studies that published within the past 3 years since the COVID-19 from 2020 to 2022, and then published in peer-reviewed journals in English language. Resilience measured in either healthcare workers or patients during COVID-19. And then we excluded studies that conducted among general population, for example, among university students, among adult populations, and so on. And then all the review articles, discussion papers, editorial opinion, and abstract without full text. And then papers that did not report the reliabilities of the questionnaires. Okay, and then for the quality appraisal of the papers that we have assessed, we use a mixed method appraisal tool to evaluate the qualities of papers included in this review. Since we only include 11 papers conducted cross-sectional, we appraise papers based on 5 criteria. We look at the sample strategies to address the research question, whether the sample represented the target populations, as I mentioned in the inclusion criteria, the measurement are appropriate, the risk of non-response bias are low, and finally, statistical analysis appropriate to answer the research question. So, based on our search, we ended up with 11 papers that fulfill the inclusion criteria. Most of the papers that we excluded due to the non-reporting of reliability and validity of questionnaires, the use of questionnaires are not clear, they self-developed their questionnaires, and then they are not related to the resilience in healthcare research. Okay, for the results, 11 papers were included in the final review after screening for the inclusion criteria and quality appraisal. All the questionnaires are all the papers are cross-sectional design and conducted in 9 countries. 9 papers were conducted among healthcare workers and 2 papers among patients with chronic illness and COVID-19. And then all papers were published within 3 years' time. Okay, so from these 11 papers, 4 types of questionnaires has been used. The most commonly used questionnaires was Kota Kinabalu Resilience Scale. 5 studies used this questionnaire. The brief resilience scale, the resilience scale 2, and then the resilience scale for adults. 1 study used this questionnaire. Okay, so and then let's answer the objective number 1, the research question 1, and then for the research question 2, we would like to know what are the domains of resilience that included in the questionnaire. So for this research question, we use the thematic analysis. We look at all the domains in the questionnaire, all the construct that they put to inside the questionnaire, and then we come up with the common domains in the questionnaire are competent. As you can see, most of the questionnaire they have the construct related to the competence, social competence, personal competence. Yeah, and then the second one is acceptance. To be resilient, we need to have acceptance. We need to accept the condition, the adversity. And then the last one, and then the most important two is support. Resilient is related to the what type of support that we receive. For example, family cohesion, social resources, they are all related to the support. But for the brief resilience scale, it's only have unitary construct of resilience. There's no domains in this questionnaire. So basically, all 3 other questionnaires, they have the construct that consists of competence, acceptance, and support. Okay, for the discussion, 4 questionnaires were used to measure resilience, which are the CDRIC, brief resilience scale for adults, and the most commonly used is Kota Kinabalu Resilience Scales. Yeah? Okay, and then the brief resilience scale by Smith consists of unitary construct resilience. Since it's comprised of 6 items, this scale is appropriate for rapid use in clinical setting to collect the baseline data before starting any intervention to promote resilience. And then there's some argument that original authors constructed questionnaire like CDRIC based on cognitive or individual factors of resilience, thus limiting the application for other populations such as a younger population, youth and adolescent. Most commonly domains included the questionnaire are competence, acceptance and support. However, other domains are unrelated. So for the conclusion, this scoping review discussed 4 questionnaires used to measure resilience in healthcare research during COVID-19 pandemic. All questionnaires are based on the quality appraisal. We found that all questionnaires were reliable with comba alpha more than 0.7, and then it can be used in various populations, not only in healthcare research, but research outside the healthcare. And then the most prominent domains in the resilience in the questionnaire are competence, support, and acceptance. So with that, thank you so much.
Thank you. I will ask a question, waiting for the floor to decide if they have a question.
Okay, no problem, sure.
Thank you. I wanted to know if in your target population, if you have tried to screen, try to compare the results within the target population, the different age groups in the target population.
No, we don't have inclusion criteria for age group because we just want to know what are the studies conducted in healthcare research, either in healthcare workers or patients. So there's no age group.
So you
Yeah.
don't have age group.
No age group.
Maybe for the professionals,
Yeah.
maybe for the patients, I can understand, but for the professionals, isn't it interesting to go and see which age group would be more resilient?
Oh, okay,
Are
okay.
they the most experienced or the less experienced, more daring because they're new and they're fresh, or the ones who are more experienced or are the more experienced? It means that they're somehow tired of what they're doing. And it's easier for them
Easier for them.
to get tired or whatever. I don't know, but I feel like this would be interesting.
Yeah, I think that's a good suggestion, Prof. But these studies is just to review the whatever available published in the article. Maybe for the next project we will consider that, because of we want to know about the exposure to the adversity, whether it can change someone's level of resilience. Yeah.
Okay, and according to your first results, how much is the prevalence of resilience in your population?
No, because of because of the purpose of this review is not to measure the prevalence, because we only have to.
You are doing a review.
Yeah, review.
The work is to do a review. I understand, but from doing the review and from your contact with I don't know, have you had any contact with the workers?
Oh, okay.
Workers? No?
But what I can say from my reading of the articles, the 11 articles, and then articles outside.
I don't need physical contact. I mean also
because
reported.
Basically, the resilient in healthcare workers. I'm talking about healthcare workers because my background is nurses, so I can say that they have a not lowest level of resilience. They have a quite high level of resilience, but based on their age actually. Based on the age. And those who are newly graduated, because of they have lack of experience, they don't know how to manage they're quite having low level of resilience compared to this with many years of experience.
Okay. Thank you.
Okay, thank you.
Thank you. And it is now that we welcome Mr. Juan Adwa as our
Good afternoon. Hi. Okay, so I think that's enough backpain for today, because I'm the only one from landscape field today, and I think for this time. Okay, so my name is Juan Adwa Izdiha Sharfa. I'll be presenting a paper titled of Reviewing Tree Risk Inventory Framework for Tropical Urban Trees by Malaysia Experts. Okay. So Matt Hansen has discovered that Malaysia has lost 14.4% of its forests between 2000 and 2012. It is the highest rate in the world due to deforestation. So the forest has lost the ability to protect against natural phenomena such as storms, landslides, and floods. Thus, trees in urban setting also had to face the consequences. So after too many tragedies of dead trees, the launch of 100 million trees campaign by Ministry of Energy and Natural Resources are very beneficial for us human beings to keep receiving the advantage of one living trees could offer. So, however, a new proper and systematic management and maintenance system is essential to improve our management practice. The urban trees in Malaysia. So this study aims to explore the suggestions and comments by Malaysia experts regarding the proposed framework of tree risk inventory for tropical urban trees in Malaysia. Okay, so for some literature review, this figure summarizes the level of tree risk assessment So before that, what is tree risk assessment? So tree risk assessment is the systematic process of identifying, analyzing, and evaluating tree risk. It is a wide field of expertise that incorporates many fields of expertise. And it is a method of risk assessment that combined with its own form of data collections. So there's some tree risk assessment, and each tree risk assessment has its own data form collections. Okay, so at the bottom sides is shows the work process of tree inspection assessment in the field. This is explained by Institute of Landscape Architecture Malaysia. So the process of tree inspection assessment will start with existing tree registrations, and then doing the tree inventory and inspections, designations of tree protections, and then restorative treatments, and lastly is documentations. Okay, so moving on to the study procedures. After done some background studies and literature review, our team held some experts interview with 10 experts in Malaysia. After all the data was collected, some analysis was made, and the finding and the conclusions were put together. Okay, so all the interviews were held individually, either face-to-face or virtually. So from all the experts involved, the highest percent are experts from arborists and landscape architect, which is 30%. So moving on to the right sides for the data collected. Firstly, all the experts were asked on their familiarity regarding the tree risk assessments. So most of the interviewees that are familiar with VTA are also familiar with ISA 91 and ISA 11. So secondly, experts were asked about their experience regarding the tree risk assessment, and VTA are still the highest answers compared to the other tree risk assessments. All right, so this is the proposed framework that has been presented to all the experts, all the 10 experts. So all of the experts agree with the framework. So you can see 100% from the bar charts. And the proposed framework was accepted and improved by all of them. And they also agreed that the presented framework should be used widely in order for us to achieve a better management practice for tropical urban trees in Malaysia. All right, so after analyzing all the findings, the framework then was improved. So this is the new framework. The framework is divided into 3 phases, and each phase consists of its own criteria for tree risk inventory. So compared to the previous framework, the proposed framework, you can see at the lower side, the added, that one is the added one. So at the lower side indicates 3 categories of tree growth and establishment challenge that mutually related, which could affect the tree growth and survival. So overall, it is crucial to have one particular approach of risk inventory for tropical urban trees in Malaysia. So that's all from me. Thank you.
Okay, thank you very much.
Welcome.
I would very quickly and direct question would be, what would you say are the limitations of this research?
This research, okay. So I would say the limitation is besides about our. Sorry.
No, it's okay. Continue.
Okay. Besides for the PKP or the movement control order, because actually this study has started 2 years ago, and just like few months ago, so it takes like 2 years to for this study. So besides that is actually in this arboriculture field, we are lacking with the experts. The arborists itself, we are lacking in Malaysia. So there's a lot more arborists in outside of Malaysia, but in Malaysia, any experts will also admit that Malaysia needs more experts, as in arborists. So actually, this study is actually will help for the arborists to do the assessments. So back to your question. The limitation is to collect more viewpoint, more comment, more suggestions from the experts. So I think we need more experts so we can collect more comments.
Yeah, I was expecting you to tell me something about the COVID pandemic and the lockdown, etc. Has this had an impact on not on the study, but on the perception of your tree risk?
I don't think there's any effect because anyhow the trees will need an assessment from experts. So even if any pandemic, trees should be also live like humans. Is it answering your question?
Yes, but I would say that maybe because there was a pandemic, that one would expect that there would be a reduction of the risk or the threat on the urban tree. That's my question.
Okay. So actually, there's a data that because of the pandemic, so there's less damage for the environment. So but somehow actually the big issue in these urban trees is it's happened long ago. So we actually facing the problem that happened long ago. Like that's why I'm giving the statistic about 2000 until 2012 because of that event we lost our forests, our urban trees. So and then even if like I said just now, there's the government launched the 100 million planting trees, but because of we lack of systematic management for urban trees, it's like it's like the trees it's the same mistake. We will see the same mistake because we always keep planting the trees, but we don't manage it properly. So it will, if there's no any new system or new systematic system, there will always repeating mistakes that we will do to the urban trees.
You started in 2000. You said it started in 2000. At least this is the time where you said that in 2012, the reduction of the number of trees.
Yes, that's I showed the data of that because of the deforestation. That time frame is the highest deforestation that happened in Malaysia.
The highest in comparison to what?
The highest in the world.
20 years back or 60 years back?
20 years back, and the highest in the world.
In 20 years?
Even until now. So from 2000 until now, that's the highest.
The highest in the world?
Yes.
Yeah. Because there is a history of cutting trees in Malaysia. It's not just in 2000, it's even before.
Yeah, because that's why I said.
Cutting tropical goods.
Correct.
To have other plants, for example, coming from. Anyway, that's one story.
Okay.
Thank you. Thank you very much.
Welcome.
Thanks a lot.
Okay.
Okay, next speaker, please. Thank you very much. Professor Dr. Tita Subramanian, please.
Hi, good evening, everyone. Good evening, Prof. Dr. Farida and my fellow colleagues here. So no backache, no trees. We are going to look at something a little bit more light and easy, but very close to all of our hearts, the millennials and flexi work. So most of us here are lecturers and we love flexi work, but what I'm looking at here is flexible working arrangements and millennials. The title might seem a bit confusing. That's what someone commented. Does work better lead to feel better? What it really means is if you have a better workplace, are you going to feel better? And does it mean you're going to be more productive? So this is a paper which I did together with 3 other counterparts, Zafira from UITM, Dr. Lenora from UITM, and Prof. Dr. Bala from US. It's so unfortunate that actually Bala is on his way here to Malaysia and he's stuck in Tokyo and he's not able to join us online. So why this study? So there are 3 concepts here. Millennials, who are they? Why do they matter? Yes, they matter because they are not really different, but they are numerous in numbers. Okay, so putting it in perspective, in 2020, 50% of the Malaysian workforce were millennials. 2021, it has not changed much. And by 2025, we expect 75% of the global workforce to be millennials. So yes, they are important. COVID-19, okay, COVID-19 is a word we hear again and again and again, but what is it related to my topic? We all know that during COVID-19, work from home was the word of the day, the night, and a whole day. Yeah. Flexible working arrangement. Okay, so flexible working arrangement, there are various types of flexible working arrangement: part-time, term time, job sharing, compressed hours, and flexi work. But in Malaysia, most of the time, the organizations offer flexi work, and government has started flexi work in the form of staggered working hours only. Yeah? I use the word only. So we have a lot of multinational corporations in Malaysia doing flexi work, flexi time, 4-day week, etc. But it's very, very seldom used in many other Malaysian organizations. So that brings us to the issue. So what's the issue? AIA Vitality report back in 2019 reported that millennials are struggling with mental health issues. And in 2021, another study showed that 80% of employees actually struggling with mental health issues at the workplace were millennials, which is quite worrying. So there are 3 independent variables in this study: mental health, well-being. Okay, as far as well-being is concerned, well-being index 2019, which has got 5 components. The working life component, subcomponent showed the lowest for Malaysia. Okay, and all of them are interrelated: mental health, well-being, and of course we know studies have shown that productivity gets affected. So what's the link? Flexible working arrangements have been linked to increased mental health, well-being, and productivity in many countries. So I wanted to try to see what it is in Malaysia. Secondly, in Malaysia, flexible working arrangements are under-implemented. And this has been done, this has been highlighted by many studies, including something I did way back during my PhD in 2010. And bringing this in relation to United Nations SDG, we all know SDG 3 is talking about well-being and good health. Okay, so this paper I'm presenting here is actually part of a bigger study which I did. I'm only presenting research objective 1 and 2. So for any intervention programs, we always would like to know what are the demographic factors which have an impact on the variable in a discussion. So here, the first objective, I was trying to see whether the demographic, is there any relationship between the demographic factors of the millennials and mental health? And secondly, to examine the impact of flexible working arrangements on the 3 independent variables: mental health, well-being, and productivity. So you can see in the chart there, in Malaysia, like in many other developing countries, 60% of the labor force are in the services sector. And as for our country, services sector contributes to 56% of our GDP. Okay, I might just need to skip the LR, but I would like to highlight that we use the self-determination theory and the job characteristic theory. So as I said, this is a part of a bigger project. And in this study, we looked at the independent variables, workplace and differences. And we were trying to see whether autonomy actually has a role to play between the variable in discussion and health, mental health, well-being, and productivity. So I skipped this, but I would like to highlight that for the well-being, we all know when we use the word well-being, okay, that's just like so many different aspects, and there are so many different dimensions, so many different measurements for well-being. But in this study, I used the Seligman's well-being model, or well-being using the PERMA model, because this is one of the most commonly used for workplace. The positive emotion, P stands for positive emotion, E stands for engagement, R stands for relationship, M stands for meaning, and A for achievement. And this is a validated measure. As for productivity, there was subjective productivity, okay, since we can't measure objective productivity in this kind of studies. Subjective productivity was measured using validated scales, and we used contextual and also performance-based productivity. As for mental health, we used the general health questionnaire, which had 12 questions. We didn't use the DAS-21, but the GHQ-12. Okay, coming to methodology, it was a purposive sampling technique with a screening question, 2 questions. Are you below 40 years? Okay, so they were between 26 to 40 years, and are they working in the services sector? If the answer was yes, they proceeded. Otherwise, they exited the survey. We had distributed about 500 questionnaires, and usable questionnaire was only 394. Okay, so I move on to my findings. First finding related to first objective. So again, many ask, why do you need to find out the relationship between demographic variables and mental health? So I repeat, generally for intervention program, it will be interesting to find out, it will be crucial to find out what is the targeted population you want to do the programs on. So this was the main reason we did this first objective using chi-square analysis. Wanted to see whether there's any correlation between demographic factors and having mental health issues. So I might have to repeat, mental health here was measured using explained in terms of depression, stress, or anxiety only, these 3. So based on the 8 demographic variables, it was interesting to find that only 3 were significantly and positively related to mental health. That was gender, marital status, and those who had caring duties. So this is among millennials only, 25 to 40 years. In fact, I was myself surprised with the first finding that there was a positive relationship between males and mental health. So later I tried to read to find out how, why, what, how. So then based on past studies, actually gender difference framework showed that men actually used to mask their depression, but now as time goes by and people are more aware of it, it looks like they really didn't bother on gender, male, female. If they feel it, they just filled up the questionnaire accordingly. Okay, as for marital status, I think this was something expected, and it conformed to past studies that single girls and boys were more affected positively, had a positive significance with mental health. And as for caring duties, this was also another surprising findings. Those who had caring duties in terms of taking care of elderly, sick persons and disabled persons compared to caring duties of young children had a significant effect. Okay. Second objective was to examine whether there was a relationship between flexible working arrangement, that is workplace flexibilities, mental health, well-being, and productivity. All the 13 reflective constructs fulfilled the requirements. I did not show it here, but we tested it, and all fulfilled the requirements and the loadings. Flexible working arrangements had a significant effect on mental health, well-being, and productivity. But I must highlight here one thing. We found that it was a small effect, and I would like to say this, I related to my limitation, because as I said, this was done during COVID-19 period. Okay, so millennials already had gone back to work. They were working from home, and some of them were doing hybrid. They were doing 3 days, 4 days, 5 days working from home, and some were doing 3 days working from home, 2 days back to work. So there was some of them, as far as we could, we explained in the questionnaire, flexible working arrangement. One type of flexible working arrangement is work from home, but there are other types of flexible work. But many of them actually thought about flexible working arrangement in terms of only working from home. So the effects seem to be a bit small. So I come to the conclusion, so does work better lead to feel better? Meaning that if you have a better workplace, does it mean you feel better? Does it mean you're going to be more productive? And does it mean that you have better well-being? So in conclusion, what I can say is, based on this study, males, those who are single, and those who had caring duties on elderly and sick persons had a positive relationship with mental health. And flexible working arrangements actually had a positive impact on mental health, well-being, and productivity of millennials. So the question is, so what? What is the contribution of this study? We have been talking for a long time about flexible working arrangement in Malaysia, way back from 2010, when many countries in the East and the West have been implementing it, but we are just fighting for it. And for those of us Malaysians here, I'm sure you all are aware that the Employment Act 1955 was amended and supposed to add flexible working arrangement from 1st September 2022. Supposed to, I use the word supposed to, but on 1st September 2022, they said they're not going to add it in, but they're going to do it only on 1st January 2023. So there goes that also. Advocacy and so much of fighting for it. Finally, they agreed sitting in parliament, few sittings, everything agreed, but again, they have postponed it. So flexible working arrangement can be one of the ways to actually improve not only millennials, ours also, our well-being. And so employers should come up with structured work arrangement policy. That was the first recommendation. Second recommendation is, now that we know that certain groups of people are more affected by mental health, especially among the millennials, maybe there should be strategies to support these groups, because it goes back on to culture and well-being. So I'd like to say thank you to all of you who have lent a ear, and Prof. Farida too. And thank you also to my university, Segi University. And part of this is also from the FRGS grant. Thank you very much, everyone.
Thank you. Thank you, Professor. Thank you very much for doing very interesting presentation topic. I'd like us to ask for small clarification that at some point maybe I misunderstood, but I felt like to equalize working better with working less.
Working better with working less, no.
Working flexi work with less work.
No, not really, Prof. What I meant, what we asked in this is, if you are able to work flexi from home, from wherever you are, from remote, doesn't mean that you have to work 4 hours or less than 40 hours, but you work according to your flexibility.
That's what I suppose maybe
Sorry. No, I didn't mean that. Maybe I was not clear. Sorry about that.
Yeah. And then your prevalence of depression would remain?
Yeah.
How do you say that?
That was based on past research, which says that generally they say, past research, it's not that something I agree, they say that women tend to be more stressed. The word is stressed, so they might have more mental health. Because here the mental health doesn't...
They're doing flexi work?
No, not doing. Generally.
Oh.
So when the findings comes that it's positive, males have a positive relationship, not females. So it was a bit of a question mark for me, whether there was something wrong with my findings. On further reading, it shows that no, it's correct. It was just that not much have been researched on males having a positive relationship.
I doubt. And again, I would say that knowing what we know about how which work, who does what work, and how much workload is done,
yeah,
and which work is accounted for and which work is
not counted for.
I would say that they are right to
say. Okay.
to find that they're probably they have mental issue. Yeah.
Actually, you're right.
Yeah, thank you. Thank you very much.
Okay, thanks, bro. Thank you, everyone. Oh, any questions? Oh, yes.
One question, great. Have the mic here.
Yeah, sure.
Hi, Prof. I'd like to ask on the proposed assembly.
Yeah.
What type of questions did you ask in order to get the right millennials to answer? Whether you ask them whether they are emAs, no symptoms.
Oh, no. There were only 2 questions. We just wanted to know whether they were millennials, 26 to 40 years, and we wanted to capture services sector. We can't ask them whether they have mental health issues. Of course, that's already starting off wrongly. We want to know whether there are issues. We can't ask them, do you have, right?
Any questions that looking to investigate, the screening questions of whether they have anxiety or those.
Oh, in the GH12 questions, they have that. compared to the DAS-21. DAS-21 is more about the symptoms of, it's more like a symptomatic of mental health. This one says questions like, I feel tired, I feel overworked, I feel very stressed. Light and easy, but still measuring whether there's anxiety, depression, or stress in their work life. Yeah. Okay, thanks, Joanna. Thank you, bro. Thank you.
Okay, so we're getting steadily towards the end of this session. And our next speaker, Dr. Tom Kinney, please, the floor is yours.
Yeah, very good afternoon to all of you. Thank you to be here. Right, so for this afternoon, I will be presenting on the paper with the title of Willingness to Use Public Transport in Kuala Lumpur and Manila. So my co-author, Prof. Kita, Mr. Rashid, and also Associate Professor Lenis from Philippines. So thank you for them. We collaborate on this paper. So I will go through for the paper. So first thing, for the, we know that in cities, it's actually the traffic congestions is actually an issue whenever we go to the city, right? Even when we travel to KK here, we also realize that there's like whenever we grab a car, so we also face this kind of like issue. So we like to examine the willingness of Malaysians and also Filipino, just focus on the city, so Manila and also Kuala Lumpur. So the in terms of the using of public transport, and we want to examine the factors which influence the willingness to use public transport in Kuala Lumpur and Manila. So we are using purposive sampling technique, so self-administrated questionnaire distributed to 250 respondents by using PLS SEM analysis, right? So this is actually in line with the SDG 11, right? So the problem statement here, so despite of the large investment in the public transportation from the government spending, so but the ridership of the public transport among Malaysians is still low, all right? And also the reasons for the low intention in the using public transport, it can be like dissatisfactions with the current public transport service, all right, or else like low accessibility of the public transport in the longer travel time, especially compared with grabbing a Grab and also using an MRT. So we're looking into like which would take shorter time, right? So the objective of the study, there will be two objectives: to identify whether demographic factors is actually the issue in terms of having a relationship with the willingness to use public transport in the city, in KL and also Manila. So the second objective here is the factors which influence the willingness to use public transport in the city, in these two cities here. So here, so looking into here, factors influencing the Malaysian public transport user. So there will be slight difference between these two countries, LRT and also MRT. And then for Philippines, they will be using like some others like small transportation in their country. So in view of the differences here, so we will actually look into for the methodologies. So we're able to collect for the 209 respondents, 103 is actually from KL, and also 106 actually from Manila. So these are our results. So by using bootstrapping and also for the path analysis, we found that the result here, we have 4 independent variables whereby we look into for the reliability, perceived qualities, and perceived value, and also the efficiency of using public transport towards the willingness to use the public transportation in both city, KL and Manila. And we found out that for the reliability, it actually has a significant relationship in Manila, and then whereas for the efficiency of using public transport schedule is actually significant relationship in KL for the willingness to use the public transport. So of course, for the demographic part, we found out that youngsters, millennials, they are more willing to use public transport in Kuala Lumpur itself, right? So, but for those actually, especially they have family, so they already have their own car, so they would actually, the willingness is actually lesser compared to the other group, right? So here, so worth noticing in the result is that the factors of perceived quality of public transport, which is not significantly related to the willingness, and also the perceived value of the public transport is found that is not relevant to the willingness to use the public transport. In contrast to the Manila LRT users, consider the transport schedule as an important factor in using the public transport. Right, so now we will pass to our co-author from Philippines, Associate Professor Lennis, to present on the conclusion and the recommendation part. Yeah.
Thank you very much, Dr. Kimi. Am I heard there?
Yes, I can hear you. We can hear you.
Okay, thank you very much. So I'm Astrid from the Philippines, and now I'll be presenting our conclusions and recommendations. So for this study, there are two major conclusions. First, only age has a significant relationship with the willingness to use public transport to cities, where most of millennials use public transport to the cities. Secondly, it is very interesting to know that efficiency plays a significant factor in the willingness to use public transport in Kuala Lumpur, while in Manila, the dominant factor which influences the users is reliability. Thirdly, even though cars provide point-to-point service, the citizens' preferred choice of transport is MRT or LRT trains, which might be due to safety and reliability. And this shows the change in the conventional transport systems that the preferred choice by the millennials. And the contribution of these findings should facilitate improvement to aspects of public transports in the cities of Kuala Lumpur and Manila. It also shows that there's a need to rethink passengers' needs and requirements. The current work should also assist service providers and policymakers to identify and specify which useful approaches should be introduced to enhance public transport, and especially in the preferred mode. And as MRT and LRT is the preferred mode of public transport to cities, the governments and service providers should focus on improving the services by increasing the frequencies, making it more reliable and efficient, and secondly, interconnectivity from point to point should be given due consideration. And that is for our conclusion and recommendation. This is our study, Willingness to Use Public Transport in Kuala Lumpur and Manila. I'm with Dr. Kimi, Dr. Geeta, Rashid, and I myself, Asid. Thank you very much for listening to our presentation. Back to you, Kimi.
Yeah, thank you so much, Lennis. All right, so thank you for the collaboration in terms of like this KL and also Manila. So I think that's all for our presentation. Thank you so much, Prof. Dr. Fatima and all the audience here. Thank you so much.
Thank you very much. Any questions from the attendants? No? I do not have a particular knowledge of what type of public transport there is in Kuala Lumpur, for example. Is it public or is it private or is it both?
Both. Yeah, as long as it's public transport, then we would be.
Is it state managed, well, local authority managed, or is it managed by companies?
Managed by company.
Private companies.
Yeah, and then they actually collaborate with the government. Yes.
Okay, so it's like it's like licenses and how do you do companies to run and manage public
yeah, for both country.
Okay.
Yes. Yeah.
And does this mean trams, underground, so buses, or is it just buses? What is it?
All including we have already included in our questionnaire as well. We are using Google Form. So inside it, before the answer, we will actually mention that those public transport, including MRT, LRT, buses, and then in their country, like Philippines, there would be like ridership on others, like their local public transport. That would be included as a whole, as a public transport for our survey. Yeah. Yeah. So in future, we would plan to have like maybe go into like interview them for the operator and also for the selective respondent. Yeah, those actually frequent user. Yeah, to have a further study on that.
Yeah, because when you say it is run by companies, it is run for the benefit of the local. But this is tax money.
Yeah,
that's public money. So theoretically, we have the same issue. Well, it's supposed to be tax money, and if it is tax money, I would say that there are ways of participative ways, democratic ways, etc. for people who feel that it's not efficient, it's not reliable, etc., to make their voices heard.
Yeah.
Theoretically.
Yeah. Yes. Yeah. Definitely. Yeah.
Yes, please.
In your questionnaire or in your did you actually ask them whether they come up with economic consideration when they use public transport? Because based on what you have shown to us, they actually more the priority is more on efficiency. And what's one, because it's quite different in terms of response from the Manila and also respondents.
Yeah. Yes. We separate the two respondents, so we run separately for the data, and then under our questionnaire, we did ask them. For example, I'm willing to pay for public transportation because the benefit is actually over for the cost, and I'm willing to pay for the public transport service even if they cost more. Yeah. So we need to think of we did. Take into consideration of the economic perspective. Yeah. Thank you for your questions. Yeah.
One question. It's interesting that in Manila is reliable. Kuala Lumpur is efficiency.
Yeah. Yes.
Does that mean, is it because like it's less reliable over there? Some open in Manila and in Malaysia it's kind of run on schedule, but then you have to like change destination. We don't have the circular line yet.
Yeah, I think for Manila it's actually for Manila. Thank you for your questions. For Manila itself, the reliability is actually quite significant. But how your question is actually how about Kuala Lumpur, right? I think for Kuala Lumpur it's actually already reliable. Okay, in that sense, it's actually not. It's not the concern anymore. So now it's actually into the efficiency. Of course, from there, I think it will actually lead us to narrow down in our studies. Yeah. Yeah. Thank you. Thank you for the feedback. Yes.
Thank you very much.
Thank you.
Okay, so thank you. This was our briefing session. I declare it closed, and I everybody to I think a tea break.
Tea break.
That's so? Yes, tea break.
It's supposed to start.